Hello, welcome to the Head on Head News Cabin. Hope everyone's hanging in there. Saturday, April 4th, 2020. I'm going to read you three stories I think are really good and important. One is about face masks. There's a lot of misinformation. The CDC just now has changed their guidelines. In previous videos, I was talking shit about the CDC, just about how I think it was obvious that masks are something that helps stops the spread, right? But this article does a really good job of just laying out everything that kind of happened and the different reasons why face masks were not recommended in pretty much all Western countries up until just now. And I mean, to me, that's the thing, is why didn't we look at these other countries? I mean, there's now the other part of it is that they wear masks a lot of times just normally. So that, and this again, it's not that simple of a subject. This article here from Arstechnica is really good, and I'm going to just read all the way through it. And then we got a Harvard Business Review article about lessons from Italy. Take a look at that. And then the other article is from Reuters about the Bureau of Prisons releasing inmates as a result of the coronavirus, because in prisons it spreads very rapidly and there's already inmates dying. So those are the three articles, and right off the top we're going to get into the Worldometers numbers. All right, there we have it. 1,141,000 cases, 61,000 deaths. All right, take a look at the curve. Looks like it's flattened out, so I guess good news here for Saturday, if you can call that good news. But this is definitely what we're looking for, is to just not be going straight up. So I think we should call that good news. And then we'll go down to the countries. We're going to be taking a look at an article about Italy, about what we can learn from them. 14,681 deaths. This number has not moved. And the US with 7,451. All right, first article about face masks from Arstechnica. Face masks for COVID-19, a deep dive into the data. This article really lays out all the different aspects of what has happened up until now, and the reasons why there was all of this ambiguity and lack of clarity as to whether face masks are effective. As COVID-19 cases increase sharply nationwide, some health experts are now recommending that seemingly healthy members of the public wear cloth masks when they're out and about. On April 3rd, President Trump announced a new federal recommendation urging the public to wear cloth masks to prevent people who are infected but may not have symptoms from unknowingly spreading the disease. The recommendation is an about-face from previous guidance on mask usage. Until now, officials at the World Health Organization, the U.S. Centers for Disease Control and Prevention, and other agencies worldwide have discouraged the public from wearing masks unless they are sick or caring for someone who is sick. They noted that there is little evidence to support mass masking, and that the limited data we do have suggests it may reduce disease transmission only marginally at best. So that's the thing, is I think this part is really important. They basically, because it wasn't a complete solution, that's okay. With evidence of benefits in short supply, experts also raised concerns about potential harms. Mask wearing may give people a false sense of security, some experts said. This may lead some members of the public to be lax about other far more critical precautions, such as staying 2 meters apart from others, limiting outings, and washing their hands frequently and thoroughly. Moreover, donning an uncomfortable, awkward mask may lead some people to touch their faces more, some argued, and face touching has the potential to transfer virus particles from contaminated hands to entry points such as the eyes, nose, and mouth. And even if a mask wearer's hands are clean to begin with, simply touching their mask could contaminate their hands if there are viral particles caught on the outside. If that's the case, a mask wearer could then transfer virus particles from their mask to their face unwittingly, negating any benefit of having the mask. They might also transfer the virus from their mask to their environment by touching surfaces where the mask particles could get picked up by other people. Last, they argued the masks that would be most effective at stopping the new coronavirus, SARS-CoV-2, are things like N95 respirators and surgical masks, which are in short supply worldwide. Without questions, these should be preserved for the heroic frontline health workers who are putting their lives at risk every day to treat patients with COVID-19 during this overwhelming pandemic. While experts unanimously agree on that last point, that proper medical masks should go to healthcare workers first, the other points are now up for debate. With SARS-CoV-2 now spreading widely and unchecked through communities nationwide, experts are taking a more favorable look at the limited data behind masks preventing disease spread among the public. In a recent commentary, a group of UK and Hong Kong researchers argue that there is an essential distinction between absence of evidence and evidence of absence. And though there are no large, high-quality studies looking at public mask usage, there is some data to support mask usage. As for potential harms of mask wearing, such as fraught face fussing and wearers relaxing other precautions, experts are now dismissing the concerns. Wearing a mask in public could keep people alert to current health risks in public, some experts say. A conspicuous mask strapped to your head is a constant reminder right over one's nose to be mindful of possible viral transmission. And, as a bonus, if everyone wears a mask, it could lessen the chances of stigma of those who wear them because they are sick. Of course, wearing a mask does not replace other interventions like staying 2 meters apart or practicing good hand hygiene, says Joseph Allen, an expert of exposure assessment science in the Department of Environmental Health at Harvard School of Public Health. It's just one more layer of protection. The scale and scope of what we're facing requires or mandates taking every precaution we can, he says. As such, some experts, Dr. Allen included, are now in favor of having the healthy public wear homemade cotton masks or other face coverings that could act as a basic physical barrier. It's not as good as medical masks, but it's better than nothing, Dr. Allen argues. So, with the conflicting reasoning and logic, what does the data on masks actually show? How were they dismissed before but embraced now? Here's a rundown of the pertinent data. Transmission. First, to understand why masks could be helpful at blocking SARS-CoV-2 transmission, it's important to understand how the coronavirus is transmitted. And frankly, we still don't know all the answers to this question. So far, SARS-CoV-2 mainly appears to move from one human to another by being launched in a relatively large respiratory droplets. These are unleashed when an infected person breathes, talks, coughs, or sneezes. These droplets are relatively heavy. They generally don't travel much further than 2 meters away from their launch site, and they follow a ballistic trajectory. That is, they fall toward the ground after blastoff. But if they land on a person's face before that or fall to a surface a person will soon touch, they could cause a new infection. There's also the possibility that SARS-CoV-2 can spread in smaller respiratory droplets called aerosols, less than 5 micrometers. These are droplets we exhale that are so small they can hang in the air for minutes to hours. Experts at the WHO, World Health Organization, and elsewhere say that the data so far suggests aerosol transmission is not the primary way the virus spreads, though it is still possible. So far, it appears aerosol transmission is mainly a concern for healthcare workers while they're performing certain medical procedures on COVID-19 patients, such as placing a tube in their airway to aid breathing in intubation. This may create circumstances for the virus to aerosolize and linger in the air in hospital rooms. Whether SARS-CoV-2 is aerosolized in everyday settings is still unknown and up for debate. Some experts, such as Dr. Allen, believe that it could be happening. Others are more skeptical of the idea, given that infected people only infect 2 to 3 other people on average. If each COVID-19 patient were creating infectious clouds of SARS-CoV-2 wherever they went, some experts would expect the patients would infect far more people on average. Measles, for instance, has been associated with airborne transmission for decades, and each measles patient on average may infect 12 to 18 people or more. There's even evidence that measles virus can disperse through ventilation systems. Though that doesn't appear to be the case for SARS-CoV-2, experts like Allen caution that the size of virus containing respiratory droplets is a continuum, not subject to clear cutoffs or strict rules. There is evidence that if SARS-CoV-2 does make it into aerosols, the virus can survive in the air for hours in laboratory conditions. Last, there's evidence that SARS-CoV-2 particles that land on surfaces or objects can loiter and potentially be picked up by others. These contaminated surfaces and objects that can then transfer the infectious virus particles are called fomites. Masks may keep a wearer from putting a fomite-contaminated hand to their face, but masks may also act as fomites. Alright, so that's pretty interesting breakdown of how the virus transmits. So basically there's 2 ways. If it's aerosolized, it might be able to linger in the air, and if not, it's coming from our spit, our saliva, small droplets. Either way, it seems that masks would be effective. Now we're going to go into this Harvard Business Review article, Lessons from Italy's Response to Coronavirus. As policymakers around the world struggle to combat the rapidly escalating COVID-19 pandemic, they find themselves in uncharted territory. Much has been written about the practices and policies used in countries such as China, South Korea, Singapore, and Taiwan to stifle the pandemic. Unfortunately, throughout much of Europe and the United States, it is already too late to contain COVID-19 in its infancy, and policymakers are struggling to keep up with this spreading pandemic. In doing so, however, they are repeating many of the errors made early on in Italy, where the pandemic has turned into a disaster. The purpose of this article is to help U.S. and European policymakers at all levels learn from Italy's mistakes so they can recognize and address the unprecedented challenges and presented by the rapidly expanding crisis. In a matter of weeks, from February 21 to March 22, Italy went from the discovery of the first official COVID-19 case to a government decree that essentially prohibited all movement of people within the whole territory and the closure of all non-essential business activities. Within this very short period of time, the country has been hit by nothing short of a tsunami of unprecedented force, punctuated by an incessant stream of deaths. It is unquestionably Italy's biggest crisis since World War II. Some aspects of this crisis, starting with its timing, can undoubtedly be attributed to plain and simple sfortuna, bad luck in Italian, that were clearly not under the full control of policymakers. Other aspects, however, are emblematic of the profound obstacles that leaders in Italy faced in recognizing the magnitude of the threat posed by COVID-19, organizing a systematic response to it, and learning from early implementation successes, and most importantly, failures. They didn't learn from, they were the first hit, so they had less time to learn. It is worth emphasizing that these obstacles emerged even after COVID-19 had already fully impacted in China, and some alternative models for the containment of the virus in China and elsewhere had already been successfully implemented. What this suggests is a systematic failure to absorb and act upon existing information rapidly and effectively, rather than a complete lack of knowledge of what ought to be done. And this is also what the last article shows. Here are explanations for that failure, which relate to the difficulties of making decisions in real time when a crisis is unfolding, and ways to overcome it. Recognize your cognitive biases. In its early stages, the COVID-19 crisis in Italy looked nothing like a crisis. The initial state of emergency declarations were met by skepticism by both the public and many in policy circles, even though several scientists had been warning of the potential for a catastrophe for weeks. Indeed, in late February, some notable Italian politicians engaged in public handshaking in Milan to make the point that the economy should not panic and stop because of the virus. A week later, one of these politicians was diagnosed with COVID-19. Similar reactions were repeated across many other countries besides Italy and exemplify what behavioral scientists call confirmation bias, a tendency to seize upon information that confirms our preferred position or initial hypothesis. Threats such as pandemics that evolve in a nonlinear fashion, i.e., they start small but exponentially intensify, are especially tricky to confront because of the challenges of rapidly interpreting what is happening in real time. The most effective time to take strong action is extremely early when the threat appears to be small, or even before there are any cases. But if the intervention actually works, it will appear in retrospect as if the strong actions were an overreaction. That is a game many politicians don't want to play. The system's inability to listen to experts highlights the trouble that leaders and people in general have in figuring out how to act in dire, highly complex situations where there is no easy solution. The desire to act causes leaders to rely on their gut feeling or the opinions of their inner circle. But in a time of uncertainty, it is essential to resist that temptation and instead take the time to discover, organize, and absorb the partial knowledge that is dispersed across different pockets of expertise. Avoid partial solutions. A second lesson that can be drawn from the Italian experience is the importance of systematic approaches and the perils of partial solutions. The Italian government dealt with COVID-19 pandemic by issuing a series of decrees that gradually increased restrictions within lockdown areas, which were then expanded until they ultimately applied to the entire country. In normal times, this approach would probably be considered prudent and perhaps even wise. In this situation, it backfired for two reasons. First, it was inconsistent with the rapid exponential spread of the virus. The facts on the ground at any point in time were simply not predictive of what the situation would be just a few days later. As a result, Italy followed the spread of the virus rather than prevented it. Second, the selective approach might have inadvertently facilitated the spread of the virus. Consider the decision to initially lock down some regions but not others. When the decree announcing the closing of northern Italy became public, it touched off a massive exodus to southern Italy, undoubtedly spreading the virus to regions where it had not been present. This illustrates what is now clear to many observers. An effective response to the virus needs to be orchestrated as a coherent system of actions taken simultaneously. The results of the approaches taken in China and South Korea underscore this point. While the public discussion of the policies followed in these countries often focuses on single elements of their models, such as extensive testing, what truly characterizes their effective responses is the multitude of actions that were taken at once. Testing is effective when it's combined with rigorously contact tracing, and tracing is effective as long as it is combined with an effective communication system that collects and disseminates information on the movements of potentially infected people and so forth. So many actions at once that influence each other is the way that you can stop the spread of something like this. These rules also apply to the organization of the healthcare system itself. Wholesale organizations are needed within hospitals. For example, the creation of COVID-19 and non-COVID-19 streams of care. In addition, a shift is urgently needed from patient-centered models of care to a community system approach that offers pandemic solutions for the entire population with a specific emphasis on home care. The need for coordinated actions is especially acute right now in the United States. Learning is critical. Finding the right implementation approach requires the ability to quickly learn from both successes and failures and the willingness to change actions accordingly. Certainly, there are valuable lessons to be learned from the approaches of China, South Korea, Taiwan, and Singapore, which were able to contain the contagion fairly early. But sometimes the best practices can be found just next door. Because the Italian healthcare system is highly decentralized, different regions try different policy responses. The most notable example is the contrast between the approach taken by Lombardy and Veneto, two neighboring regions with similar socio-economic profiles. Lombardy, one of Europe's wealthiest and most productive areas, has been disproportionately hit by COVID-19. As of March 26, it held the grim record of nearly 35,000 novel coronavirus cases and 5,000 deaths in a population of 10 million. Veneto, by contrast, fared significantly better with 7,000 cases and 287 deaths in a population of 5 million, despite experiencing sustained community spread early on. The trajectories of these two regions have been shaped by a multitude of factors outside the control of policymakers, including Lombardy's greater population density and higher number of cases when the crisis erupted. But it's becoming increasingly apparent that different public health choices made early in the cycle of the pandemic also had an impact. Specifically, while Lombardy and Veneto applied similar approaches to social distancing and retail closures, Veneto took a much more proactive tack towards the containment of the virus. Veneto's strategy was multi-pronged. Extensive testing of systematic and asymptomatic cases early on, proactive tracing of potential positives. If someone tested positive, everyone in the patient's home as well as their neighbors were tested. If testing kits were unavailable, they were self-quarantined. A strong emphasis on home diagnosis and care, whenever possible, samples were collected directly from a patient's home and then processed in regional and community labs. Specific efforts to monitor and protect healthcare and other essential workers. They included medical professionals, those in contracts with at-risk population, and workers exposed to the public. The rest of that article is linked in the description. Really has a lot of good information about what happened in Italy and how we can all learn from it. All right, lastly, we're going to take a look at this article about what's going on with the prison population. U.S. Attorney General orders release of more federal inmates due to coronavirus pandemic. U.S. Attorney General William Barr declared on Friday that the Federal Bureau of Prisons is facing emergency conditions due to the fast-spreading coronavirus, paving the way for the agency to begin releasing more inmates out of custody and into home confinement. Barr said under his emergency order, priority for releasing vulnerable inmates into home confinement should be given first to those housed in federal prisons that have been hardest hit by COVID-19, including facilities such as Oakdale in Louisiana, Elkton in Ohio, and Danbury in Connecticut. Barr's order comes after 5 inmates at FC1 Oakdale and 2 at Elkton died from COVID-19, the respiratory illness caused by the novel coronavirus. The BOP said Friday that 91 inmates and 50 of its staff throughout its 122 institutions have fallen ill with COVID-19. Union officials and families of prisoners have told Reuters they believe the numbers of people sickened with the virus is much higher. Earlier this week, the BOP took the unprecedented step of ordering all of its facilities to place inmates into a 14-day quarantine by confining them to their cells or living quarters. The $2 trillion stimulus bill signed by President Donald Trump last week included a provision designed to make it easier for federal prisons to release more inmates into home confinement to help control the coronavirus outbreak. Prior to the stimulus law, the BOP could release to home confinement only inmates who had already served at least 90% of their sentence or had no more than 6 months left to go. The new law allows the BOP director greater discretion to release a larger cohort of inmates, but it required that Barr first declare a state of emergency for the federal prison system. For all inmates whom you deem suitable candidates for home confinement, you are directed to immediately process them for transfer and then immediately transfer them following a 14-day quarantine, Barter directed the BOP in a memo released late Friday. Criminal justice advocates have warned for months that U.S. jails and prisons are potential hothouses for infection. Inmates live in close quarters, share bathrooms and dining halls, and often have limited access to health care. Many have been critical of Barr for not taking action sooner to release more inmates from jails and prisons, a move that some states like New York and California have shown a greater willingness to do. Earlier on Friday, Reuters reported that federal prosecutors around the country in recent weeks have fought back against a variety of efforts by inmates to be released, even temporarily, due to the coronavirus pandemic. In court filings, prosecutors have urged judges to deny release on bond to defendants who are in jail awaiting trial, and suggested that some inmates with pre-existing medical conditions would be safer in prison than at home, among other arguments. U.S. House Committee Chairman Jared Nadler cheered Barr's order on Friday, saying it was much-needed action to lower the prison population amid the pandemic. This is a positive development, and I urge appropriate and swift use of this power, Nadler said in a statement. Alright guys, so those are the 3 articles. We had the Harvard Business Review telling us about what the things are that we can learn from Italy, the different types of responses that they've had in 2 different provinces, Veneto and Lombardy. Talked about the mask issue, again, why there's been this different response and this confusion about its effectiveness. It really seems like, and this was the point that the Harvard Business Review article made, it's not about the information not being there, it's about processing the information. So I think that that's what we're going to learn within this pandemic. So we kind of have to stay positive and understand that this is complicated and hard, and everyone's doing the best they can, and we're all learning. So that's what I got for you. Keep your hat on your head. Thanks for tuning in.